Welcome everyone. Thanks for coming on this extraordinary walk event. If I can just start by acknowledging traditional owners on whose land we're having this conversation, Wurundjeri folk, and acknowledge our long-standing relationship with elders past, present and emerging, and recognising, I think, the key leadership that the ACCHO sector has offered community health historically in what a good primary care response looks like. So we at Cohealth are really clear that whilst community health as we know it has a great deal to offer the community, the real leadership exists in the ACCHO sector, and the sooner we recognise that, the closer we are to developing an effective primary care sector for this country. But thank you all for coming and sharing a little moment here at 365 Hoddle Street. This is a site of considerable significance for us, because if you look up behind us, you can see several public housing towers that traditionally have been the communities that use this service. It's been here since the Whitlam era, this building, which is one of the reasons why we're so interested in some funding to redevelop it, because actually it's kind of a little bit rickety, and much as it is highly valued by the community, it does definitely need some improvement. So part of our Vic Votes pitch is really to get the state government to acknowledge that we can't deliver high quality services out of facilities that aren't fit for purpose. Bit of a shout out there. I know the Greens have made a commitment to contributing funding in the event that they should be in a position to do so post the election. I really want to acknowledge that leadership. Thanks, Kathleen. Can I also acknowledge the other folks here are going to talk a little bit about what Cohealth means to us. So Kim, of course, is a long-standing community advisor and activist in this community and within Cohealth. Aram, my colleague too, who's had a really key role actually in helping to organise today. So thanks for that, Aram. We thought we might interview each other a little bit. So we were going to start off just talking a little bit about what community health means to each of us. So maybe I might start with you, Kim, and just ask that question.
Yeah. Well, you want to know about the community for us?
Sure.
And that is for our whole oral family.
Yeah.
And our local community, and then especially the residents in the Collingwood housing. For us, what is health and well-being in the future. We want something more, everything they got here, we don't need to go too far and just walk distance, we can have our health be looked after.
Yeah, yeah. And Aram, what does community health mean to you?
I think one of the great things about community health is that intersection between providing services directly to people who need them and advocating for the systemic structural change that causes poor health for folks. So thinking about income for people, thinking about housing, thinking about access to really good food. I think community health's always played a really important role in delivering services and talking about those bigger issues. And that's what I love about working in this sector, actually. What about you, Lynn?
Yeah, what about me? Well, all of those things, and I guess I would also add that one of the things we've become really clear about in community health over the last few years is the role of stigma and discrimination, both in creating ill health but also as a barrier to care. And that takes in racism, but it takes in a whole form of other isms, a whole range of other isms. And I think that one of the things I love about community health is we know we're not perfect and we know we're not there yet, but we also know we try really hard to work in partnership with individuals, families and communities to understand what models of care that work look like. And we see that right across the full gamut of, everything from drug safety services, and I think we'll talk a little bit later about that on our walk, refugee services for newly arrived folks, but also services that really strongly try and integrate a social context with a clinical care. And it's our contention that a failure to do that within the mainstream healthcare system is what produces barriers to care and what ultimately means that people who are in some way marginalised have significantly poorer health status. And I think that understanding for us is really, you talked about taking that message systemically. systemically, that's really our mission as we see it. So here we have a whole range of services and a whole range of people who need them, using them and accessing them, and big shout out to our clinical care providers who do a magnificent job. But as an organisation, we know that that's the bottom of the cliff, and that where we really need to be working is at the top. And I know you all know that because that's why you're here.
Can I say some more? Yeah, because Cohealth, I've been with some of the local crime. They've been here, using here. We have a meeting together, and I was surprised. I only using this service only 20 years since I moved in here. And one of the clients he been using for 40 years, and he said Cohealth been look after his family, and his mom's family, and his family, and now his children's family. And then at the same time, we all together we got 10 of us. With the last comment, Cohealth is our second home. We all saying, I was surprising. So for myself, I always say Cohealth is my second home. And because when you come in here, you see the crime, you're never expecting you will see them in somewhere else. When you see them, you say, oh, she's still alive. And then we're talking and start conversation. That is how we love that. And the only thing is that because Cohealth, like Lynn said, is too old, and then we need more funding to build, and we don't need to go somewhere else for the dentist, for all the services and more clients. Especially now, a lot of new immigrants that come here. And then this is the only health center that provide interpreter for the local people. If you can't speak English, you go to local surgery, they can translate in their language. So for the new immigrants, it's very important. Thank you.
Thank you so much.